Hello, welcome to the Stellalife Innovator series. I'm Liz Lundry, and today I'm very excited to interview Joy Moeller. Joy started her career as a dental hygienist and became a myofunctional therapist in 1980. She is a leading expert in the field and teaches principles of myofunctional therapy at numerous universities worldwide as a guest speaker, including the USC School of Dentistry, Gutenberg University and the University of Freiburg in Germany, the University of Louvain in Brussels, among many other institutions. She taught at UCLA in the sleep medicine mini residency program in oral pain for 7 years. She treats patients in her private practice and is on a mission to improve people's lives through the life-changing practice of myofunctional therapy. Welcome, Joy.
Thank you for inviting me. This is wonderful.
I'm so happy you're here, and I'd like you to share with us, more information about what exactly myofunctional therapy is and what it does for people.
So myofunctional therapy is a neuromuscular facilitation of all of the head and neck muscles. People think it's just the tongue, but it encompasses 58 different muscle groups in the head and neck. What we do is teach proper chewing, breathing, and swallowing exercises. And those are very important functions of the body. The tongue is actually a respiratory organ, and it contains 16 muscles in it, and it works with the diaphragm to bring more oxygen into the lungs. And currently, myofunctional therapy has been proven to help situations like orthodontic relapse, open bites, also sleep apnea. It's been proven to help sleep disorders because we work a lot with the genioglossus, the back of the tongue. It also helps with periodontal disease because, as we all know, if you're a mouth breather, you're going to have a lot better chance of having gingivitis and periodontitis. Also, if you think of it, every aspect of dentistry is affected by myofunctional disorders. Everything from endodontics, if your tongue is pushing against the teeth, to prosthodontists, people who are grinding and clenching their teeth. You have to look at why. So much of it is if the tongue is resting in the proper position, it can stabilize the jaw.
Yeah.
So
it's all connected there. So you can't take one without the other. And we really need to look at the whole picture to best serve our patients. So it sounds like there are many benefits.
The list goes on. Speech problems, posture problems, digestion. If you're not swallowing right, you're swallowing air.
Right.
And you're not chewing, you're missing the enzymes that help to break the food down. So I think just about every aspect of healthcare may be affected by myofunctional disorders.
I know. And we're seeing so much growth and more interest in the area of sleep medicine and treating of sleep apnea. And, doctors are now looking, and the hygienists also are looking at where the tongue is as far as any breathing disorders go, because if the patient can't breathe, then nothing else that we do really matters, right? That's the number one thing. And we can and should be screening for that with all of our patients.
Absolutely. I'd like to share a video of a patient that I treated quickly.
Yeah, that's great.
And so this is a little boy, Thomas, and he was referred by his father, who was a pediatrician.
This is Thomas, and Thomas is just starting myofunctional therapy today, which is November 18, 2016. And can you tell me, Thomas, why you're doing this and what you hope to accomplish?
I'm doing this to stop my tics and improve and breathe through my nose all the time, and I hope to accomplish everything that Joy gives me.
Good.
And
help your posture
yeah,
too.
help my posture.
So this was him after 7 months, but when he was finished, it was exciting because
So this is Thomas, and Thomas is now completely done with myofunctional therapy. And can you tell everybody in the audience what your thoughts are about it, how it's helped you?
When I first started, my head was really forward, and my eyes were ticking almost every 3 seconds. And over this time that I've been with Joy, I've really improved. As you can see right now, I'm blinking with both my eyes, not blinking anymore.
How's your sleep and all this?
So I used to snore and sleep on my side, and that affected my sleeping and breathing.
Now you're sleeping pretty well.
Yeah.
You're sleeping on your back and breathing through your nose all the time too, right?
Yeah.
Can you swivel your chair so we can just take a look at your posture? Wow, look at that. And then the other side too. Yes. Wow.
So he
really
improved.
good, Thomas.
A lot of people wanted to know about why his eyes were blinking all the time, and they called it Tourette syndrome. But my hypothesis is the back of his tongue wasn't functioning right, and the cranial base is above that.
Wow.
And I've seen other people with similar types of problems that where they have movement disorders that change with biofunctional therapy.
That's so dramatic and so great that he found you at this early age, to be able to grow properly and to not have, it must have been so frustrating for him to live with that tick all the time, socially and everything else. So that's really impressive. And I'm getting goosebumpy. That was great. So how does this benefit the dental practices when this is part of their what they offer their patients?
The offices that actually incorporate myofunctional therapy, their practice completely changes. People in the United States right now, because of all the science that's come out and people are talking, mothers groups and doctors in Stanford and Northwestern and all over the world actually are saying find a myofunctional therapist, and there really aren't very many. So I feel this belongs in dentistry. We see patients, as hygienists see them every 3 or 6 months, and it's an ideal time to intervene in the dental office. It helps the practice in so many ways. You'll be inundated with new patients. People are looking for this treatment, and it helps every aspect of dentistry, everything from perio to endo to restorative work to aesthetics, cosmetic dentistry, every aspect of dentistry. Once they go through myofunctional therapy, they want to change everything else in their mouth, and they feel excited. Orthodontics for sure.
Yes.
Help or orthodontic relapse. The most important thing is prevention, because if you get a child when they're young, you can prevent so many things, and it's so rewarding. It really does enable us to integrate the oath that we all took in dentistry to help people and prevent problems, especially.
Absolutely. So definitely for the children, but I know you treat adults as well. And I know that as far as, people being able to improve their function, maybe they've had chronic pain, they can't breathe, they're snoring, but also improve their appearance by creating fuller lips and a more balanced face. And that is possible to do with people of any age. What are some of the oldest patients that you've treated successfully?
I've treated people in their 80s. And the beauty of myofunctional therapy, the breathing, chewing, and swallowing, once you integrate it into who they are, they keep changing. And all of those people that are clenching and grinding and having jaw pain, so much of it is the instability of the muscles.
Right.
I know as dentists, I worked in a TMJ office for 11 years, and we all want to get the bite just perfect and, look at that. But unless you look at why is this happening,
right,
and fix that, the long-term stability won't be there.
Right. You have to really get to the foundation and the cause of everything.
I see a lot of patients who have been given a nice, beautiful splint and it helped, and then the dentist eventually retires and the splint breaks and the patient can't find the right splint again, to help. And so those people too are coming to me because it's something they haven't tried before. But the sleep thing alone, I mean, so many people in the world have sleep disorders now, especially worse since we wore masks for 3 years.
Right.
And did all that. So they're looking for solutions.
Well, we're a sleep-deprived society as it is. However, when we sleep, we're just not sleeping well. And if we're not breathing and snoring, people aren't aware of how serious snoring really is, how it affects your entire circulatory system and, can predispose you to strokes and other diseases. So, just a really an opening and emerging field. And we have so many people that we can help. So if a doctor or any hygienist or anybody would be interested to, go into this field, what are their resources? Because as a doctor, it's great if you can have a myofunctional therapist there as part of your team. But if not, you can have somebody in your area to whom you can refer. And I know that you see people remotely, so that's an option for anybody. But how can people find out more about this?
Well, the best way is to start taking courses. I teach with the AOMT, the Academy of Orofacial Myofunctional Therapy. I've been teaching with them for 25 years. I was one of the founders of it, but there are other people teaching courses too through the IAOM, the International Association of Oral Myology. There's companies like MRC that are selling their little products that help. There are many ways to study this and get started. So I'm very excited to be able to share this information with everyone.
Yeah, I'm so happy we had this opportunity. And for all of you out there, I really urge you to look into this. We can do so much more to really, truly improve people's lives on a very fundamental level. They will live longer, they'll breathe better, they'll be happier, and they'll love you even more than they already do. So thank you so much, Joy. Thank you for all you do and for being such a pioneer and for all the help you've given to so many people. And thank you, everybody, for joining us for this installment of the Innovator series. Please come back so we can all keep learning more and we can help more people as we do that. Thank you all.